The deadlift exercise is commonly misunderstood and oftentimes gets a bad reputation. However, we utilize the hip hinge movement pattern throughout our everyday movements, whether you know it or not. So let me chat through some of the ways that we can integrate it best into your training so that it is most functional for your lifestyle. Hi, I'm Dr. Zack Ratliff, chiropractor at TruMotion Therapy in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal injuries and pain. Many people associate the deadlift motion with a barbell with plates on either side, which can be fearful or bring anxiety on for people that may have had pain or issues with that movement in the past. So let's chat through some different variations of the hip hinge or deadlift, and then we can find the one that's most applicable for your training. So Brittany's gonna do a couple deadlifts here with the bar. The shins are staying vertical, those hips are going straight back, and it's a nice smooth motion, and we're utilizing the hips more so than the low back. The torso is just staying locked in. But with the barbell, it does stay out in front of the body and sometimes can become irritable on the low back for certain people. So one way that we can modify this is we can add plates underneath the barbell and elevate that bar, because most oftentimes the bottom part of that range of motion is where it gets most irritable. So as she does it now from this position, she doesn't have to get to that very end range. And so until we get more comfortable with it, this can be a great training modification. So moving on from there, if that one has caused pain or it's been an issue in the past, Brittany, let's come over to the kettlebell here. So the other way we can do this, and you can bring that kettlebell to the floor to start. So we can do a kettlebell variant of this. The thing I like about the kettlebell is it can stay right in between your feet, right in between the knots on your shoelace. And this allows that weight to stay a little bit more center of mass and not out in front of you like the barbell. But then similarly, if that bottom part of the range of motion is a little irritable, causes any issues, we can easily take that kettlebell over to an elevated surface or a step. And all this does is takes out that bottom piece of the range of motion. If that's not approachable, or maybe you just don't even have a weight, another way that we can get a very similar training stimulus here, we're gonna still utilize that hip hinge movement. This is called the banded good morning. So that band is behind the neck, kind of right above that upper back, and it's right in the middle of the feet. And so instead of a weighted resistance, we're utilizing a banded resistance. With all of these variations, the big emphasis is as we're coming back up into a straightened position, we're trying to push our feet through the floor, and we're utilizing our glutes and hamstrings while the core and torso stay nice and neutral, straight, and not getting too much extension and not rounding too much at any point during that movement. The hip hinge or deadlift movement is super important for our daily lives, whether it's picking up your toddler off the ground or it's picking up groceries out of the trunk of your car. It is something that we do every day, and so we need to integrate it into our training. If you are having issues with that, I would love to help you out with that. Please check out our website, www.trumotiontherapy.com, where you can get more information, schedule an appointment, and we can walk through the best variations that'll be most applicable for your training.